Center test prep exam date. Question 1. A patient presents with severe epigastric pain radiating to the back, nausea, and vomiting. The nurse notes ecchymosis around the umbilicus. This finding is known as Option A, Gray-Turner sign. Option B, Cullen sign. Option C, Murphy's sign. Option D, Vrofsing sign. The correct answer is Option B, Cullen sign. Cullen sign, periumbilical ecchymosis, and Gray-Turner sign, flank ecchymosis, indicate retroperitoneal hemorrhage, classically associated with hemorrhagic pancreatitis. Question 2. A patient with a history of alcohol abuse presents confused and ataxic. To rule out Wernicke's encephalopathy, the nurse should prepare to administer Option A, folic acid. Option B, vitamin B12. Option C, thiamine. Option D, magnesium sulfate. The correct answer is Option C, thiamine. Wernicke's encephalopathy is caused by thiamine, vitamin B1, deficiency, common in chronic alcoholics. Thiamine must be administered before or with glucose to prevent precipitating or worsening the condition. Question 3. Which finding on end-tidal CO2, ETCO2, monitoring indicates successful endotracheal intubation? Option A, ETCO2 of 0 mm Hg. Option B, persistent ETCO2 waveform with each ventilation. Option C, ETCO2 of 50 mm Hg. Option D, a flat line waveform. The correct answer is Option B, persistent ETCO2 waveform with each ventilation. Waveform capnography is the gold standard for confirming ET tube placement. A persistent, characteristic waveform of exhaled CO2 confirms the tube is in the trachea. Zero or flat line reading suggests esophageal intubation. Question 4. The best method to remove a prosthetic eye in an emergency is Option A, using forceps to grasp the prosthetic. Option B, applying suction with a bulb syringe. Option C, using a suction cup designed for prosthesis removal. Option D, sweeping a finger around the edge to break the suction. The correct answer is Option C, using a suction cup designed for prosthesis removal. A small suction cup designed for this purpose is the safest method. Alternative methods can damage the prosthesis or the surrounding tissue. Question 5. Which laboratory value is most indicative of acute kidney injury? Option A, elevated white blood cell count. Option B, elevated creatinine and BUN. Option C, decreased platelet count. Option D, elevated liver enzymes. The correct answer is Option B, elevated creatinine and BUN. Elevated serum creatinine and blood urea nitrogen, BUN, are the hallmark lab findings of acute kidney injury, reflecting decreased glomerular filtration rate. Question 6. A patient with chronic COPD presents with increased dyspnea. The nurse understands that the primary stimulus to breathe in these patients may be Option A, elevated PaCO2. Option B, low PaO2, hypoxic drive. Option C, increased pH. Option D, elevated HCO3. The correct answer is Option B, low PaO2, hypoxic drive. Some chronic CO2 retainers rely on the hypoxic drive as their primary respiratory stimulus. Oxygen therapy in these patients should be titrated carefully to maintain SpO2 between 88 to 92% to avoid blunting this drive. Question 7. A patient with acute respiratory distress has the following arterial blood gas: pH 7.22, PaCO2 58, PaO2 62, HCO3 24. This represents Option A, uncompensated respiratory acidosis. Option B, compensated respiratory acidosis. Option C, uncompensated metabolic acidosis. Option D, compensated metabolic acidosis. The correct answer is Option A, uncompensated respiratory acidosis. The low pH, acidosis, with elevated PaCO2, respiratory component, and normal HCO3, no metabolic compensation yet, indicates an acute, uncompensated respiratory acidosis. Question 8. A nurse is caring for a patient with a suspected pelvic fracture. The presence of blood at the urethral meatus indicates the need to Option A, insert a urinary catheter immediately. Option B, perform a retrograde urethrogram before catheter insertion. Option C. Irrigate the bladder with normal saline. Option D. Prepare for suprapubic catheter. The correct answer is option B. Perform a retrograde urethrogram before catheter insertion. Blood at the urethral meatus is a classic sign of urethral injury. A retrograde urethrogram must be performed to assess urethral integrity prior to any catheter insertion attempt. Question 9. A patient presents with sudden onset worst headache of my life. The nurse's first priority is: Option A. Administer pain medication. Option B. Perform a complete neurological assessment. Option C. Prepare for lumbar puncture. Option D. Obtain a non-contrast CT scan of the head. The correct answer is option D. Obtain a non-contrast CT scan of the head. The sudden thunderclap headache suggests a subarachnoid hemorrhage. A non-contrast head CT is the first diagnostic test to rule out hemorrhage. Lumbar puncture follows if CT is negative and suspicion remains high. Question 10. The emergency nurse should have a high index of suspicion for an occult eye injury in a patient with: Option A scalp laceration. Option B, an orbital wall blowout fracture. Option C, a nasal fracture. Option D, a mandible fracture. The correct answer is option B, an orbital wall blowout fracture. Blowout fractures of the orbit involve the thin bones of the orbital floor or medial wall and often involve entrapment of extraocular muscles or injury to the globe itself. Question 11. A patient presents with cramping abdominal pain, distension, vomiting, and high-pitched tinkling bowel sounds. These findings are most consistent with: Option A, gastroenteritis. Option B, bowel obstruction. Option C, irritable bowel syndrome. Option D, acute pancreatitis. The correct answer is option B, bowel obstruction. The classic presentation of a small bowel obstruction includes cramping pain, abdominal distension, nausea/vomiting, and early high-pitched, hyperactive bowel sounds, borborygmy, that become absent later. Question 12. The initial fluid resuscitation bolus for a patient in septic shock, per surviving sepsis campaign guidelines, is: Option A, 250 ml of 0.9% normal saline. Option B, 500 ml of D5W. Option C, at least 30 ml/kg of isotonic crystalloid. Option D, packed red blood cells to achieve a hemoglobin of 10 g/dl. The correct answer is option C, at least 30 ml/kg of isotonic crystalloid. Current guidelines recommend an initial bolus of at least 30 ml/kg of 4-isotonic crystalloid solution, for example, normal saline or lactated ringers, for patients with sepsis-induced hypoperfusion or septic shock. Question 13. Fat embolism syndrome is most commonly associated with fractures of the: Option A, distal radius. Option B, pelvis and long bones. Option C, clavicle. Option D, metatarsals. The correct answer is option B, pelvis and long bones. Fat embolism syndrome occurs when fat globules from bone marrow enter the circulation, most commonly after fractures of long bones, femur, or pelvic fractures, causing respiratory distress, petechiae, and CNS changes. Question 14. Under the Emergency Medical Treatment and Active Labor Act, EMTALA, a medical screening exam must be provided to: Option A, patients with private insurance only. Option B, any person who comes to the ED and requests care. Option C, US citizens only. Option D, patients with urgent conditions only. The correct answer is option B, any person who comes to the ED and requests care. EMTALA mandates that any individual presenting to a Medicare participating hospital with an emergency department must receive a medical screening examination, regardless of ability to pay, insurance status, or citizenship. Question 15. A patient sustains a laceration and has not had a tetanus vaccine in 12 years. The wound is clean and minor. The nurse should anticipate: Option A, no tetanus prophylaxis needed. Option B, tetanus immunoglobulin only. Option C, TDAP or TD booster. Option D, tetanus toxoid and tetanus immunoglobulin. The correct answer is option C, TDAP or TD booster. For a clean, minor wound and a vaccination history of more than 10 years since the last dose. A TDAP or TD booster is indicated. Tetanus immunoglobulin is for patients with unknown or incomplete vaccination history and contaminated wounds. Question 16. Which of the following is the priority assessment when a patient is found to have rhabdomyolysis? Option A, neurological status. Option B, renal function and urine output. Option C, skin integrity. Option D, cardiac rhythm and rate. The correct answer is option B, renal function and urine output. Rhabdomyolysis involves the breakdown of muscle tissue, releasing myoglobin into the bloodstream. Myoglobin can precipitate in the renal tubules, causing acute kidney injury. Monitoring urine output and renal function is critical. Question 17. The emergency nurse suspects acute epiglottitis in a patient presenting with option A, inspiratory stridor, drooling, and tripod positioning. Option B, barking cough, low-grade fever, and hoarseness. Option C, productive cough, pleuritic chest pain, and fever. Option D, wheezing, prolonged expiration, and accessory muscle use. The correct answer is option A, inspiratory stridor, drooling, and tripod positioning. The classic triad of epiglottitis includes inspiratory stridor, drooling, from inability to swallow, and the tripod position, leaning forward on hands. This is a life-threatening airway emergency. Question 18. A 25-year-old female presents with sudden, severe unilateral lower abdominal pain and vaginal spotting. She has an IUD. The nurse's priority is option A, obtain a urine pregnancy test. Option B, administer pain medication. Option C, prepare for pelvic exam only. Option D, discharge with follow-up. The correct answer is option A, obtain a urine pregnancy test. The presentation suggests a possible ruptured ectopic pregnancy, which is a life-threatening emergency. A pregnancy test is the critical first step. An IUD increases the risk of ectopic pregnancy if conception occurs. Question 19. The clinical finding that differentiates a massive hemothorax from a simple pneumothorax is option A, absent breath sounds. Option B, dullness to percussion on the affected side. Option C, trickle deviation. Option D, subcutaneous emphysema. The correct answer is option B, dullness to percussion on the affected side. With hemothorax, blood in the pleural space, percussion produces dullness due to fluid. In pneumothorax produces hyperresonance due to air. Both cause decreased breath sounds. Question 20. The safe harbor provision for nurses typically refers to option A law that provides legal immunity in all circumstances. Option B, a process where a nurse can request a peer review of an assignment they believe is unsafe without immediate fear of retaliation. Option C, a hospital policy allowing nurses to refuse any assignment. Option D, the requirement to report all medication errors. The correct answer is option B, a process where a nurse can request a peer review of an assignment they believe is unsafe without immediate fear of retaliation. Safe harbor laws allow a nurse to accept an assignment they believe is unsafe but to invoke a formal review process that provides a degree of protection from licensure action or employer retaliation. Question 21. A patient presents to the emergency department with a laceration that requires sutures. During the procedure, the patient states they feel faint. The nurse's first action is to option A, administer oxygen. Option B, place the patient in Trendelenburg position. Option C, immediately discontinue the procedure. Option D, assess vital signs. The correct answer is option C, immediately discontinue the procedure. The nurse should instruct the provider to immediately stop the procedure to reduce vagal stimulation and prevent syncope. After the procedure is stopped, the patient can be placed supine and assessed. Question 22. A patient presents with a chemical eye splash. What is the priority nursing intervention? Option A, patch both eyes. Option B, immediate copious irrigation with water or normal saline. Option C, administer topical antibiotic drops. Option D, perform a visual acuity test. The correct answer is option B, immediate copious irrigation with water or normal saline. Immediate and prolonged irrigation of the affected eye to dilute and remove the chemical is the single most critical intervention to prevent permanent corneal damage. Irrigation should precede any other assessment. Question 23. The most common cause of lower gastrointestinal bleeding in adults is: Option A, gastric ulcer. Option B, diverticulosis. Option C, esophageal varices. Option D, malloy-Weiss tear. The correct answer is option B, diverticulosis. Diverticulosis is the most common cause of lower GI bleeding in adults. Upper GI bleeding is most commonly caused by peptic ulcer disease. Question 24. The priority patient for a trauma team activation based on mechanism of injury is: Option A, an adult who fell from standing height. Option B, a pedestrian struck by a car traveling 15 miles per hour. Option C, an adult ejected from a vehicle. Option D, an adult with a gunshot wound to the forearm. The correct answer is option C, an adult ejected from a vehicle. Ejection from a motor vehicle is a high-risk mechanism of injury that alone warrants trauma team activation and comprehensive evaluation, regardless of initial vital signs. Question 25. A patient leaving against medical advice, AMA, must be informed of: Option A, they cannot ever return to this hospital. Option B, their bill will be sent to collections. Option C, the risks and potential consequences of leaving. Option D, the police will be called. The correct answer is option C, the risks and potential consequences of leaving. A patient who has decision-making capacity has the right to refuse treatment and leave AMA. The nurse's duty is to inform the patient of the risks, alternatives, and potential consequences of their decision, and to document this thoroughly.